like to thank the organizers of the Symbiosis Institute of Health Sciences for inviting me and my organization Narayana Health to represent in this wonderful conference. Thank you so much. Uh, we've been asked to give a perspective of the hospitals and how are we looking at Ayushman Bharat. Firstly, I think it's long overdue for our country that we have something like this. There are two indicators which reflect the progress of a country. It is health and education. And I think Dr. Sanjay in his session in a very detailed and in a very nice manner, elaborated that the macro elements of how of the various variables that are influencing our environment. And I think it's long overdue that India had a universal health care in some form or the other. Now, it's for us as providers and also as insurers and everybody else who's involved to accept that this is how it's going to play out here onwards. And how are we adapting to it is something that will be the test of every industry's character. Now, this Ayushman Bharat scheme, which was launched last year, which is about 6 to 7 months, has taken off. The initial response has been mixed. All of us are still trying to figure out, what this scheme entails, how is it going to influence us completely. If you look at the dashboard the dashboard for the Ayushman Bharat, clearly the enrollments, this is as of the 15th of April, clearly the enrollments are happening. We have more than 15,000 hospitals which have enrolled, out of which 49% of them are private. And if we look at about 64% of the treatment are happening in private hospitals. So which literally suggests that the response is there. And the people are using this as an opportunity to grow their work, and the faster they adapt to this new scheme, the better. However, if you were to look at it, the corporate hospitals are still tentative. The adoption of the corporate providers has been a little slow, and I am going to dwell in the next 5 to 7 minutes on why is it so. And it's not that we are against the scheme. We are very happy for the scheme, but it's very important for us to be able to adopt to it in a manner that we do justice to the scheme completely. So what are the anticipated challenges that we see in this scheme? We are just getting directly into the implementation of the scheme. One is the extremely low rate of packages that have been included in the Ayushman this. Some of the package rates are even lesser than the cost of manpower and materials. We understand that it's still initial days. We've got experience from other schemes which are in place, like the Bhamasha at Rajasthan, the Mayojna, the Arogyashree in Andhra Pradesh. So somewhere, as network providers, we know that we have some perspective to how these schemes function, and predictably Ayushman has kind of taken off from where these earlier schemes which were there in various states, how they have performed. So expectedly the cost of the package rates are low, and some of the package rates of some selected procedures under Ayushman Bharat, they vary between 24 to 90% of the average cost incurred by hospitals to carry out these medical procedures. Now, hospitals is a very capital intensive industry. The kind of cost that has hit hospitals, both from a fixed and an OPEX point of view, they can be very varying. Now, for us to be able to respond and deliver the scheme in a viable manner and in an optimal manner that benefits the patient, requires a lot of working. The other challenges are, doctor shortages. I mean, if you were to look at it from a public sector point of view, to be able to meet the demand that is going to come from Ayushman Bharat, because we are going to be having so many more patients coming for treatment, is going to be phenomenal. So definitely we're going to need to have a lot of doctors. We need to have a lot of healthcare, force necessary, whether it be technicians, the nursing, all of that is going to play a very important role. Now again, for the government to manage this Ayushman Bharat program, it definitely needs far more private participation. And we actually see that government of Gujarat has actually, when it launched the Mayojana, I think 2 years back, they actually came up with a lot of very interesting schemes, where it invited private participation and gave them subsidies to for investing in high-end infrastructure, high-end equipment. So a lot of this would be necessary eventually going forward to be able to, take on Ayushman Bharat. Now, going forward again, all the existing schemes need to be again reevaluated, need to be reassessed. The procedures of empanelment, and most importantly, the costing of procedures. That's an important thing that we have been in discussion with even Dr. Indu Bhushan, is that somewhere we need to take a more objective look at the costing that is going on today. The other thing that is an issue is reimbursement. See, our experience with a lot of other institutional government institutions like whether it be the ESIC or CGHS has been the reimbursement pattern. So that is a concern. The NABH accreditation will ensure quality, but then at this point in time only a small number of hospitals have NABH. Now to be able to serve Ayushman Bharat the way it has been envisioned would require quality to be a very important area of focus, and I'm sure the government is looking at it, and involvement of private providers will also ensure that they will be able to pursue quality when they serve the Ayushman customers. Now, there is a need to widen the network, as we have already mentioned, and there was a brief mention, Mr. Bhaskar was mentioning, one concern that really gets to us, and the experience that we've had with a lot of other schemes, is the enrollment of beneficiaries into the schemes. There needs to be a proper control, because a lot of times we feel that it's managed because of the mechanism in place. It's not very difficult to get a card. People, even those who don't really not really eligible, entitled for this for the card, get it. So somewhere we want that those controls to be far more stringent. So a lot of people keep asking us, so now what is it for the healthcare providers? How are you looking to respond to this new phenomenon? It's something that this is something so disruptive that I'm sure every corporate hospital, every private hospital, the government, the health secretaries across India, they're spending more than 50% of time just discussing now how do we respond to Ayushman Bharat. It's evolving. So there was a very nice paper presented by, written by Michael Porter and Thomas Lee. This is the strategy that will fix healthcare. And why I'm presenting it very quickly is that this is something that we all are discussing, which we all have been discussing internally, that could pretty much be the way we look at things. Clearly, our focus till now has been, very doctor-led, and, we get okay, we start a specialty, get a consultant, let them run their specialty, run their clinics. We need to completely move it to ensure that there is patient centricity at the core. Everything has to be aligned around the patient. What I mean by that is that he talks about having integrated practice units. So, for example, you have a diabetes clinic. You have all the related specialists who are sitting together just to take care of a diabetes patient in a comprehensive manner. Now, diabetes is pretty much a systemic problem, so you will also need apart from the nephrologist, you'll need the cardiologist, you'll need, you might have GI issues, you'll need an ophthalmologist, and all the associated things. And that apart from even the operations, the all operations elements of the program, that has to be integrated into a practice unit, and we need to be delivering that care to the patient. So clearly, the integrated practice unit or the multidisciplinary clinics wherein the patient gets to see whoever they need to see in one go, and they are charged on the basis of that. They have a faster, they have a shorter time of interaction with the people whom they need to meet. They, the outcomes are far more better because everybody is around them, and they have been able to, send them home quickly. So the experience is far more better. So this is one thing that, all of us are saying that, okay, let's move away from the conventional, manner of dealing with patients and move it around disease management. The second one is that it's inevitable that today we will have to get down to monitoring our outcomes, because India culturally needs to move to that. We need to report our outcomes, just like it's something that's so very prevalent in the West. We need to start reporting our outcomes. For that, we need to start measuring them, and also our costs, because when we are coming to, when there is so much of regulation coming place, there is going to be, we've already seen in the last 2 to 3 years that there's been a lot of capping on consumables, implants. The nature of our pricing is going through a change. Earlier, it was quite a known fact that especially hospitals which were a part of a network, they kept the price of services low, and their sustenance essentially came from consumables, devices, because they had the ability to negotiate with suppliers, for the kind of volumes they generated. Now, when we've had these changes coming in the last 2 years, obviously the entire model has gone for a change, and people are having to take a relook at, and we are having to take a relook at how we are pricing our services. So this is a dialogue that, we also need to continuously have with the insurance companies and the government on how we price our services. But, as a precursor to that, monitoring of costs is extremely critical. Your procedures continuously on a periodic basis, keep monitoring your costs and see how you're doing vis-a-vis them. And like I just mentioned, that the current way of pricing for packages, servicing for bed charges and all, somewhere we need to, I think over a period of time, we will need to grow out of that and look at more innovative ways of pricing. So all of us are thinking about it. Then focus on differentiation. You don't need to do everything. When you go to a particular location, what most people do is that, okay, we need to start all the specialties. What we realize is that we just run ourselves so thin that we're not able to service all the specialties. Just focus on certain select areas of your strength and do them well. So that is going to be, a lot of hospitals are going to get to doing that. And, there is going to be a lot of geographical, as far as geographical expansion of services is going to happen. You're going to see the hub and spoke models, which are going to be less about constructing new hospitals, greenfield projects, and more about partnerships and strategic alliances. And at the base of it, the enabler is going to be IT. For whatever you do, whether it be your IT and technology, whether it be your EMRs, your health records, all of them for purposes of measuring outcomes, costs, reimbursements and all, IT is going to play a critical role. So you will not be able to move forward without having good IT systems. So this was a very interesting paper, and I'd like to finish it. So eventually, what are hospitals? What are they going to be doing? They're going to prioritize the services they can deliver for a specific region. There's going to be a focus on differentiation, and cooperate the larger tertiary quaternary care hospitals. We are going to focus on providing high-end care. Service is going to be a very important differentiator in patient retention. We need to understand that with this there are going to be a lot of medical legal cases coming. You're going to have a lot of the literate health activists who are going to keep reading up the Google before they come to your clinic. So the hospitals need to be ready for them. I've talked about monitoring patient outcomes. Quality, we've discussed about it. Monitoring of costs of the procedures and the overheads. The role of technology. And the other important development that we are seeing today is that hospitals will want to stay to its core competencies of patient care. And you're actually going to see some new models coming up where, there's outsource of supply chain. Okay, you can handle the companies who can manage supply chain, so why don't we outsource that to them? So you're going to have some of manpower, all of that is going to come forth. And the role of medical education is going to really take off. You're going to actually see, the nurse, emergence of the nurse practitioner coming forward. And I think all of these together is going to contribute to, to the growth of our industry. We'd be happy to take any questions. I think we run out of time. Thank you.